Concussion Decisions and Outcomes. This presentation has two objectives. We'd like to examine the decision to report or not report a possible concussion and discuss the consequences of your decision. First, let's make sure we all have an understanding of what a concussion is. A concussion is a brain injury that is caused by a blow to the head or body. It changes the way your brain normally works. It can range from mild to severe, and it does not require you to lose consciousness. Understanding what a concussion is, however, is only part of the story. When you think you may have a concussion or have any of the symptoms that are associated with a concussion, you have a decision to make. Do you tell someone or do you not tell anyone? It sounds simple, but the wrong decision has consequences for you and the people around you, your friends, your family, and your teammates. We examined the research, talked with the experts, and read numerous testimonials from people like you to understand what tends to happen when you tell someone you might have a concussion and when you don't. First, let's examine what can happen if you decide not to tell anyone. There are a number of reasons people have for not telling anyone about their symptoms. They might feel they need to stick it out or be tough. Or they might think their symptoms just aren't that bad and maybe they'll get better with time. If you choose not to tell anyone about your concussion symptoms and delay seeking care, there are consequences. So what are those consequences? If you don't tell, you will likely feel miserable and perhaps experience higher levels of depression, anxiety, and self-doubt. Testimonials from concussion patients with persistent symptoms show higher levels of anxiety and often depression. This is compounded in athletes with a history of anxiety or depression issues prior to sustaining concussion and can be a factor in prolonged recovery. A concussion means your brain has been injured. It just won't be able to direct the rest of your body in how to react to game situations the way it did before an injury. As a result, you will perform more poorly in your sport and may not ever get back to your previous performance level if you wait. You put yourself at greater risk for other types of injury by not telling anyone about your concussion or your symptoms. Recovery from these other injuries might keep you out of competition in life longer than treating the concussion. The impact of a concussion isn't limited to physical activity or competition. A concussion can also impact your ability to focus or concentrate on a task. It can make you unusually irritable. As a result, your academic performance, personal relationships, and ability to hold down or even get a good job are all at risk. Ignoring your symptoms and forcing your brain to work through its pain puts you at greater risk for what is called a second impact. While it is rare, people have actually died from it. We're just beginning to learn more about the long-term consequences of concussions. Some studies suggest that these long-term consequences include greater risk for dementia or other mental health problems. Avoiding recurrent health trauma and long-term consequences begins with a recognition and reporting of concussion symptoms. So those are some of the things that can happen if you don't tell. But what about if you do tell? If you tell, the path to recovery looks very different from what happens when you don't tell. Here is the most common sequence of events after you tell someone you might have a concussion. First, a healthcare professional will ask you about your symptoms and examine how your brain is functioning to determine whether you do have a concussion. In some cases, you may just be dehydrated or have some other condition with similar symptoms. If you do have a concussion, they can recommend the right treatment for you, your life, and your symptoms. Then you and your brain get the help you need to recover. Improvements in how care providers manage concussions have evolved to avoid a one-size-fits-all approach and put an emphasis on keeping patients engaged in their normal lives as much as possible while they recover. Treatment for a concussion involves a brief rest period during the first 24 to 48 hours to minimize the demands on your brain. Complete rest is not recommended, and patients after this initial phase are encouraged to become gradually and progressively more active as long as symptoms are not made worse. Depending on the nature and length of your symptoms, you may be referred for specific types of rehab. The next step is that you return to activity. If you tell someone, your recovery is likely to be shorter than those who continue to participate or wait to tell someone. Early reporting leads to an early progressive return to activity that allows you to get back to life while keeping concussion symptoms at bay. As you continue to improve, you return to competition. Most importantly, if you tell, the sooner you can be you. You can return to life and all the things that make it great. While we hope you never face this choice, we also hope that the information we've provided will help you make the right choice if the time comes. There was one story we heard along our way from Paige Decker, a women's hockey player at Yale, that we wanted to share with you. So let's listen to what Paige had to say.
I went to Yale in 2010, started out as a freshman on the women's hockey team. And by the time my senior year rolled around, it was November 2013, a couple months into the season, and I took a bad hit from behind. I went to the bench to kind of regroup, and I remember being really shaken by the hit and feeling a little bit disoriented, very thrown off, sort of experiencing a lot of different physical symptoms and emotional symptoms. And so I finished off the game and went to the locker room. At that point, I was feeling really disoriented. Some of those physical symptoms were beginning to really sink in for me. My vision was really blurry, and so I had a tough time sort of orienting myself in the room, and my focus was also off, so I was really sort of confused and couldn't really focus on the words that my coach was telling me and the rest of the team at the end of our game. And I also had a really bad headache. I just kind of was in this constant sort of back and forth in my head of evaluating what I should do, whether I should tell somebody or not tell somebody, or just kind of continue to push through the pain, because I think something many athletes can probably relate to is this sort of internal pressure to push through pain. And so I applied that same logic to my concussion and ended up taking some extra strength Tylenol and sort of going through my team's warm up and playing in that game as well, even though I knew that I wasn't 100%. And then the next day, I did the same thing. I practiced and I lifted, and it wasn't until after that practice when things had really sort of escalated, my symptoms were a lot worse, that I decided to finally tell my trainer. And from there, after about 48 hours of not taking the right steps, I finally told someone. I spoke up, got the correct care, and got evaluated by a doctor and was diagnosed with a concussion. I've reflected a lot on my thought process during those 48 hours when I was masking my symptoms and actively choosing not to tell anybody. And I think what I've ultimately concluded is that I was scared to speak up. I put a lot of pressure on myself to sort of create this perception of toughness. And I applied that logic to my concussion as well. But in hindsight, I understand now that the tougher thing to do would have actually been to remove myself from play and voice my concerns and discomfort. It's actually, I think, harder to acknowledge that, right? Looking back, I wish that I had given myself that chance to really acknowledge and let people know that I wasn't okay, and sort of allow the medical professionals to do their job and step in. But I sort of let my pride get in the way of that, and I wasn't fully aware at the time of just how much I was putting myself at risk. And now I understand that, if you take another hit to the head when you have a concussion, it puts you at risk for a more severe concussion or a more severe traumatic brain injury. And I think that can lead to a longer duration in recovery or something as severe as second impact syndrome. If I could go back, I would have done very differently, because what I've learned throughout this experience is that your health is far and above the most important thing. It's the number one priority. Without your health, you literally don't have anything. And it's bigger than any game, than any sport, any team or competition. It's your life. And when you put that at risk, it's not worth it.
It is so tempting to try to play through this injury, but the consequences of hiding your symptoms or waiting to see if they can get worse can be so severe. A simple check can put your mind at ease and set you on a path toward full recovery. Telling and not telling can make all the difference in the world. And remember, it's better to miss one game than an entire season, or even life. When in doubt, get checked out.